And of course, joining me now is Dr. Andrew Wade from SouthCoast Health Imaging. Thanks so much for joining us, Dr. Wade. It's always great to see you.
Thanks for coming.
You know, of course, it's Breast Cancer Awareness Month, and many people are going out and getting those mammograms, and still, you know, a lot of people seem to let that time go by each and every year, and they don't. I want to talk with you today about 3D mammograms and what that's about. Can you tell me a little bit about the difference in a 2D mammogram, which we all are familiar with, than the 3D mammogram?
Sure. So 2D mammograms, of course, have been around for a long time, and we switched from doing those on film to doing them digitally a few years ago. And now we have the next generation of technology, which is 3D mammography. Mammograms are the best way to detect an asymptomatic disease and save lives by detecting that before someone would, say, feel a lump in their breast. The advantage we have for 3D mammography is that when this machine goes, instead of just taking a still image and shooting the x-rays through the breast once, it goes and does a sweep and takes a series of 15 images or more, depending on the patient. In any case, it delivers back, after making some calculations, a stack of images that we can look through, just sort of taking each individual level one at a time, so that whereas before we would have things, just normal tissue overlapping that we couldn't see through, especially in a denser breast, now we can see through those and see things that we couldn't see before.
You know, why is it so important, would you say, for these women out there to come in and get these mammograms and make sure it's an annual thing that you do?
We know that mammograms save lives, so that's the main thing. A woman who lives to 80 has a 1 in 8 chance of getting breast cancer in their lifetime. Mammograms detect changes in the breast over time, and when we see those changes, we know that it's something that we need to look at more closely, and that's how many times we find something that has gone wrong.
You know, I'm amazed at the people that I come in contact with that are well over 40 that have never had a mammogram. They're afraid of the process. They're afraid that it's going to be painful. How would you respond to someone like that and really talk about the importance of letting them know this isn't a painful process?
So I would respond by saying that there are some things that we go through that are just a little bit uncomfortable that we do for our health, and this is one of those.
And it could potentially save your life.
Absolutely.
With the 3D mammogram or mammography, and of course we're standing right in front of the machine here that you see on screen, and you may be able to actually hear it in the background because the machine is actually on. What about radiation? Is there a concern with radiation?
The benefits far outweigh the downside of the radiation. Yes, there is radiation, as there is with any technology that uses x-rays, but there are national standards that we're required to adhere to, and even as we add just a little bit more radiation with the tomosynthesis images, we still are well below that threshold. So we know that if you look at the actual risk to a patient of applying that radiation, it is much less than the benefit that we get in increased longevity for women who we detect breast cancers.
If you'd like more information on SouthCoast Health Imaging, all you have to do is go to the information you see right there on your screen. Remember, early detection is so very important. Now, you'll find them on Facebook. You'll also find their website, all kinds of information. Remember, Saturdays, you can get your mammograms from 9 to 1 the month of October, and they do have more than one location.